drugs. Legal, safe injecting rooms should be introduced in Australia. Myself, Josh, Daniel and Antoine will be arguing that safe houses should be included within Australia. Safe houses are locations where habitual illicit drug users, where they can discreetly use substances such as cocaine, ecstasy and heroin. The main aims of including safe houses within a society are to eliminate the dangers associated with these drugs and also to reduce the public nuisances caused by injecting within the public eye and within the local community. The main benefits of safe houses is to stop the spread of bloodborne infection diseases such as hepatitis C and HIV, which is a precursor to AIDS. Infections passed on to the user through contaminated needles. Safe houses use sterile syringes and damaging of the veins and tissues around the area through improper technique. By using within a safe injection house, an addict can eliminate these risks by being offered sterile syringes and other equipment with which they can safely take the drug. We can see that safe houses are more than injection locations where addicts can just get their high and leave. At these places, trained nurses and attendants are also there to inform the users about drugs, their side effects, and basic general health care while using. Also, many safe houses offer counselling services for those who are trying to deal with their habit, and also referrals can be made to doctors, clinics and drug rehabilitation centres if necessary. An example of the positive and beneficial nature of safe houses within a community is Insight, which is located in Vancouver, Canada. Studies have been done in this area from Marshall and North, where they have found that fatal overdoses had decreased by 35% in a 500-metre radius area of Insight within a 4-year period. Another notable statistic found by Marshall were that by comparison, the number of overdoses in the rest of Vancouver decreased by only 9%. From this, we can see that there's been a 26% decrease within the overdosing. From the safe house in Vancouver, we can ascertain that all safe houses around the general area, that there will be less overdoses within the community and ultimately improve the user's habit, but also the community around the user. Professor Neil Boyd, a criminologist at Vancouver's Simon Fraser University, conducted a study which, again, about Insight, unanimously stated the benefits of a safe house. For every $1 spent on Insight, up to $4 of the taxpayers' money is saved. The risk of contracting hepatitis C or HIV decreases as used and contaminated needle distribution is restricted. The use of detoxification services such as Insight users are encouraged to seek treatment and counselling for their addictions. Lives are being saved as Insight staff have been able to intervene during overdose events and administered first aid. There have also been improvements in public order and behaviour within the Insight area. Now Daniel will elaborate with more benefits of safe houses.
Yes, so they also reduce the incident of fatal overdoses and therefore the mortality rates in this population. They also reduce public order problems, particularly by doing away with open drug scenes, recovering use syringes, reducing the impact of drug problems on residential areas, so apartment buildings, and they also, most importantly, establish and maintain contact between the drug addict population and the social service and healthcare network, therefore possible means of getting addicts into the treatment. This alternative has also been introduced to the UK, as there is strong belief that drug use is going to happen and will not be stopped anytime soon. However, it may as well be happening in a controlled and monitored environment. Brighton in particular, for years had the highest overdose rate in the UK, has seen the number of drug-related deaths fall from 67 residents in 2000 to 22 last year. There has been a dramatic increase in the amount of addicts going into recovery programs, as the supervised consumption rooms are directly interlinked with the recovery programs. The idea is simple. When the fear, stigma and glamour are taken out of drug use, addicts are often quick to seek help. The health and community benefits are quick to follow. Now, Antoine will talk about addiction and its relation to injection.
Addiction is a term which is used interchangeably and describes a condition of powerlessness over something. Addiction is when it has more control over you than you have over it. The it can be alcohol, marijuana, heroin, sex, gambling, food, or any other drug or mood-altering behaviours. There are many positive effects an injection room can have on individuals who are addicted to drugs. Positive effects such as improvements in general health, prevention of blood-borne viral infections, and assistant entry to a drug training program, which could lead to a reduction or termination of injecting. A study that is supported by these examples were undergone by Dr. Dart from the National Drug and Alcohol Research Center, where an injection room was built in Frankfurt, Germany, where 1,200 injections per day were administered in the injection rooms, which corresponded to a reduction in the annual number of overdose deaths of around 70. This therefore highlights that a death can be assumed to have been prevented every 5 days. This evidence highlights that with a controlled reduction of injections throughout any country, deaths prevented from injections will dramatically decrease. In New South Wales, there has been a dramatic increase in heroin-related deaths from 124 in 1994 to 321 in 1996. If injection rooms were to be introduced all across Australia, fatalities will significantly decrease, as professionals who could help diminish or even cease injections from certain individuals will administer them. Even though injection rooms will not place a sudden halt on deaths from overdoses, it is the first step to a safe and maturing process to not only decrease deaths from overdoses, however, one day diminish and educate people regarding the high risks of this terrible.
So myself, Vivian and Marijan will now present arguments for or against these safe injecting facilities. Injecting in public places will promote and arouse feelings of shame for the person who attends these facilities. This conclusion was drawn after interviewing IDUs who expressed their thoughts and feelings on having legalised injecting rooms. People who see them walking into facilities will know what they do, and they will then label them as drug addicts. People feel like if they are seen walking into a legal injecting facility, it's giving them a negative identity, and these people who see them walking into them will associate them with names such as drugger and junkie. The current leading causes of death in Australia, top 4 are, according to the ABS, ischemic heart attack, ischemic heart disease, stroke, dementia, and cancer. So while we have these deadly diseases, focus should be put more on these illnesses rather than, which are causing higher mortality rates, rather than putting our funds towards a place for people to take drugs, which is illegal.
Okay, so there is also an alternative prevention to preventing the distribution of unsafe injecting and spreading of blood-borne illnesses. This actually includes removing the whole issue altogether. One example is a prevention trial that was done on junior high school students in America. It was like a program where they learnt skills on how to prevent themselves from getting into that situation, etc. The results from this experiment show that prevention for drug abuse through the skills program produced a positive effect even beyond high school years. This shows that there are other ways of preventing blood-borne illnesses and unsafe injecting, and that includes working towards eliminating the issue, which although is hard, and we see the point in making safe injecting rooms to remove them from society, but it is always better to prevent the illness, prevent the addiction altogether. And how really safe is safe injecting? I mean, yes, you do prevent the transfer of blood-borne illnesses such as hepatitis, HIV/AIDS, but the actual substance that you are injecting into your body is unsafe as well. So, and it's also illegal. There is no such thing as safe injecting, even though it is more sterile according to the New South Wales Health site, there are harsh effects of injecting illegal substances such as heroin. These include death overdose, damaged veins, loss of menstruation, loss of fertility in both males and females, pneumonia, and tetanus. So, even though you're preventing all these illnesses, you're still putting something bad into your body, and that's unhealthy either way. And also, furthermore, according to the Drug Statistics Australia website, there are over 3,000 drug-related deaths, so it's better to prevent the illness, prevent people from being addicted rather than letting them get to that point and then trying to solve the issue.
So illicit drugs are illegal for a reason. I see it as unnecessary and harmful to society, as the negative effects of the drugs would have a huge impact on people, especially young adults. Drugs which are not currently legal are illegal for specific reasons, and it's important that it stays this way in regards to not legalising safe injecting rooms and promoting. The negative effects outweigh the positives, thus they would be harmful to society. Rates in crimes such as stealing, robberies and assaults would most likely increase as a result of greater ease of use and addiction. Also, greater ease of use may encourage even younger children to engage in this poor behaviour, and then where will that generation of the future be headed? Drugs are bad and harmful unless for medical use reasons, and drug use affects an individual emotionally, physically, mentally. For example, the drug ecstasy, which is the most commonly consumed drug at parties and raves, has the following long-term effects. Markedly reduces the amount of serotonin stored in the brain. This causes depression, which is difficult to treat because it does not respond to antidepressants. After heavy use, you may also experience loss of confidence, shaking, anxiety, and confusion. This is just a little bit of food for thought, but after hearing the long-term effects, are you still willing to support your argument and encourage legal safe injecting rooms, which will ultimately encourage greater use of illicit drugs, say if it was a best friend or a loved one using it?
Lastly, it can also provide a premise for drug dealing, so these people can use these places as an excuse to also do drugs, so it's not just for safely injecting drugs. It will also delay drug users from entering a rehabilitation program. It also puts the staff in a dangerous situation, as by consuming these drugs, it can make them lose control of their own bodies and their actions and thoughts, and it puts the staff at great liability.
Just to argue with Vivian's argument regarding the fatal overdoses, illegal injecting room consists of professionals who administer the drug, therefore there will be a very low chance of fatal overdose compared to a drug addict administering the drug themselves. You say the rate of drug addicts have increased to 3,000 deaths. However, these deaths will significantly decrease with legal injecting rooms, as shown in Germany, where deaths were reduced every 5 days.
Wouldn't it be better to try and eliminate the use of drugs altogether?
That is impossible. People
I know,
That's why we're going to take the first step of having a legal injecting room to educate the drug addicts out there.
But that will give the wrong impression to other people, making them think that it's okay and condoning the use of drugs. Rather than putting them straight to a rehabilitation program, we're giving them an excuse to actually exercise their drug addiction.
And also, like, you're injecting something that's going to harm you anyway. Like,
We just cancel each other out.
they do.
Terrible act.